everyone, it's DrRic with today's unboxing of dandelion root. Dandelion root, sometimes dandelion root extract might be a little bit better just because of the volume of data on the extract. Dandelion root is what I usually will get my patients to use when they have edema or swelling of the extremities. Also nice for high blood pressure. I think that most of the data out there shows that it can be used in times of cancer, colorectal cancer, has an adjunct, not has the treatment of choice, but an adjunct. That can be also used by folks for type 2 diabetes. And again, the studies are somewhat limited, but they're still there. And then the downside is very little. There's the effect supposedly is because of number one, it has a lot of potassium in it, the root. So you got to go down deep. It's not the flower that you see in your yard. It's the root that goes down sometimes 15 feet. But if you get enough of the extract of the root, the theory is that it changes around or moves around the calcium within a cell, and that might trigger, maybe because of the extra potassium, again, this is hypothesis only, a reason to diurese or pee. Now, the patients that I have using it, and it also has been used in melanoma. So 2 decent papers with regards to melanoma or colorectal cancer. 1 decent paper as far as calcium. Oh, and I just finished the Shamrock Shuffle with my buddy Ed. So the idea is if we're trying to decrease hypertension, high blood pressure, and you happen to have edema or swelling of the extremities, swelling of the hands, it might be that you would respond to a diuretic. Now we have hydrochlorothiazide and Lasix and bumetanide, which is really tough later on for resistant patients with kidney failure. But if you're just starting out of the gates and you're just starting to notice a little bit more edema, you got a new sit-down job, you're driving a lot, you're flying a lot, and edema is adding, and you can't get out into an exercise routine just yet, but it's causing pain, well, this is what I would use first. So again, as I was alluding to, its work as a diuretic is pretty decent. Most of my patients don't have, and I use this too, most of my patients don't have a issue with having to pee like Lasix in the morning. One of these is equal to about 500 milligrams. So that is the capsule there, and that's the nutrition panel. I just like Now Foods products. They are a local company, sell it at Fruitful Yield, and I like going there. I have a lot of patients that work there. And so I don't think you're going to have at 500 milligrams a day, maybe 1,000 milligrams a day on the toughest days. As long as your kidney balance is okay and you're not having bad cramps, and you have to be careful about, I would be careful about something called digoxin if you're old school or your cardiologist is old school and is using that one particular type of medicine. Digoxin is very sensitive to the heart. It's supposed to increase inotropy, the way the muscle of the heart works, but that medicine, that medicine in particular, does not do well with low potassium levels. So in theory, this has high potassium that it gives you. Again, the studies are all in extract form. So as far as whether the capsule works, it might be an anecdote with my patients that it works, but I would do this first. So I wouldn't expect that most of my patients would be using digoxin first off. If you are, you got to be careful. But even if you are, you got to be careful with your water pills and always taking potassium level or potassium pills with it. But not to make it too confusing, and most of you aren't on digoxin, I would do this at 1 pill every morning so that you don't pee all night, every morning for about 4 to 8 weeks. Again, the extract or dandelion root itself, it might take a little bit of time before it works, so you have to be patient. You can't have hypertensive crisis and then just expect to lower your blood pressure and keep you out of harm's way with dandelion root. There are other medicines for those emergencies, but if you're just starting out with edema or high blood pressure and it's mild, like what we call pre-hypertension, I would do this every morning. If it doesn't respond after about 6 weeks, you might want to do 2 every morning, observing for the effect of peeing or diuresis. And as long as it doesn't affect the rest of your medicines, I think there's potential for lowering or helping with type 2 diabetes. Maybe there is some preventive cancer care that you might be able to take advantage of. But in its essence, if we can just lower the blood pressure, 1 pill a day before we move on to hydrochlorothiazide, Lasix, or other blood pressure medicines like calcium channel blockers, ACE inhibitors, beta blockers, and all the other ones, I think this would be a first start. Now, I have to preface this whole thing with, even though this is an unboxing, you got to exercise, you got to move, and you have to have good sleep and eat. So if you don't do that stuff first, this might be a temporary Band-Aid, but you still got to, it's a Band-Aid so you can get to take care of the root reason why you're having hypertension. Calming practice is always important because we're also stressed out. So for the meantime, fine, use 1 pill a day, see how it works. Maybe dial it up to 2 every morning, but if you have problems with excessive peeing or your blood pressure is not responding, and that sweet spot's supposed to be about 120 over 70, give or take 10 points. If you're higher than that, could be an issue. Now with the newest JNC criteria, you're allowed to go a little higher as far as the blood pressure, but again, it would be nice to get things low. And if it happens to give you extra added benefit with regards to kidney detox, liver detox, antioxidants, then great, why not? It's hard to prove in some of the small studies, but again, the downside's low. Give it a try. Subscribe to me for other unboxing I'll be doing, and let me know if you have any comments down below on how you use dandelion root or what you use for hypertension. Otherwise, I'll see you at the next unboxing.